Hi everyone, and thanks for watching this short video. My name's Elise Garrick, and I'm going to be talking about the healthy habit for the month of July. We're going to be talking about knowing your ABCs, which is a tool used to help identify problematic areas on your skin that you might need to take to a provider to get checked out or biopsied, things that help you identify skin cancer. So, first, I wanted to start out with a fun little fact. Did you know that unprotected skin can be damaged by the sun's UV rays in as little as 15 minutes? I think it's easy, especially in the summer, it's hot and you don't want to get sticky. You don't want to take the time to put on sunscreen, especially if you're going to be out only for, 20, 30 minutes. But this is a helpful fact just to know that skin damage can occur really quickly, and it can also occur if there's clouds in the sky. Sometimes, if it's overcast, people think that you don't need to wear sunscreen, but that's also not true. The UVA and UVB rays can shine through the clouds, and you can still receive skin damage even when it's cloudy outside. So, moving on to our ABCs. Again, this is a tool designed to identify problematic and potentially cancerous areas early on. And these are characteristics of skin damage that doctors look for when diagnosing and classifying things specifically like melanoma. And it's important before you learn these techniques that you also think about your body's freckles and moles or blemishes, things that are considered normal for you, normal patterns on your body, so that you can take notice if any of these changes do occur. Doing a self-exam at least every 6 months is what is recommended, especially if you have really fair skin or if you've spent a significant amount of time out in the sun. And if you find something suspicious on your skin, like any new spots or things that are different, changing, um, for example, within these parameters, the letter A stands for asymmetry, and that is a area that is not symmetrical. If you were to draw a line through it, the two sides would not match. That's one sign that you want to look for. The second one is a border. So if the spot or blemish has edges that are spreading or are really irregular, and if that happens quickly, that's something to notice. Also, the color. If you have blotchy areas with a variety of different colors, including black, blue, red, white, or gray spots, that's something to be aware of as well. And the diameter, areas that have a diameter bigger than the size of a pea. So really big blemishes and spots. And then the E stands for evolution. So areas that begin to evolve or change in size, color, elevation, if they start to become irritated, like bleeding or itching, those are all things to be aware of, especially again, things that are going to be changing over time and are considered not normal for you. Those are all going to be things that you want to take to your doctor and talk more about with them. Some other things that you can do, uh, checking the expiration date of your sunscreen. That's something that you want to do every year when you pull out the sunscreen is double check. Also trying to avoid keeping it in your car for long periods of time because that can affect how effective the sunscreen is. Also watching the clock, finding shade. So trying to avoid areas where or times of the day when the sun is really bright and high up in the sky. So between like 10 a.m. and 4 p.m., that is going to be a time of day you might want to avoid or plan your activities around that time, or find shade, provide yourself with shade, whether that's like a little canopy or a place that has lots of trees, just so you can avoid those rays. Buying a broad spectrum sunscreen is also important. You want something that has UVA and UVB protection. And you also want something that's water resistant if you're going to be spending time in the water or sweating. Typically, something of at least an SPF 30 to 50 is recommended, if not more. Wearing protective clothing like hats, sunglasses, protecting your eyes is the next point. That's something important to remember as well. And just covering up as much skin as you can if you're going to be spending a lot of time out in the sun and you're not going to be reapplying sunscreen frequently. Avoiding indoor tanning, canceling your indoor tanning subscription. Consistent exposure to these UV rays can really easily lead to skin cancer. So that's something that you want to avoid, if possible, by doing all of these things. So we want to encourage you to stay safe, especially during the summer months as it gets warmer. Protect your skin, stay hydrated, and feel free to share these tips with friends and family and enjoy the rest of your summer.